Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Today's webinar is Clinical Success for Pancreatitis, Intestinal Polyps, and Gum Disease with 40 plus years of herbal mastery with Dr. Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience treating over 500,000 patients, specializing in differential diagnosis and herbal prescription. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he has strictly purchased herbs directly from them for the past 30 years. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This special includes formulas such as his famous astringent complex, herbal ABX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as his previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed in the Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the prescription. Dr. Chang typically prescribes his patients 100-gram bottles or 150-gram bottles if they are not local or if the disease is chronic. Dr. Chang, a widely known figure in TCM community, has been instructing at eLotus for the last 2 decades, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulse Synergy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. And for our new attendees joining us, let me familiarize you with our webinar room. Please set your chat from host and panelists to everyone so that everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available by the next business day late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. Jimmy Chang.
Well, yeah. Hi guys, it's me again, Jimmy Chen. Today we're gonna talk about something that's really interesting, and not only interesting in the disease themselves, and also very interesting in our diagnosis system, the diagnostic system. I mean, the pulse diagnosis can be very accurate and very useful for this kind of problems, and the treatment is definitely very satisfactory. I'm sure we can do this. And I've encountered a lot of these things we'll talk about today. Today's what? Today is this pancreatitis, intestinal polyps, and gum diseases. This seems to be irrelevant, but actually they are related somehow to each other, huh? Okay, let's get on with it. But before that, I always say this. I think it's very important for you to bear in mind what to do or what not to do for different body type of patient of yours, no matter what the diseases are, and no matter what the Western diagnosis was or whatever. In other words, decide your treatment approach by their body type is very, very important. Even they were diagnosed with the polyps by the Western doctor, but on different body type, the treatment will be different. It's not all the same thing. for one disease. We don't do things, we don't treatment approach by their terms, by the name of the disease. We do the treatment by their type, body type and disease type. And the nature, that means the nature of the problem. That's very, very important. So that's why our Chinese medicine can be very interesting. Maybe a little bit complicated, take a little longer, take a little time, and not longer, just I mean the making the diagnosis might take a little longer, like 5 minutes, 10 minutes, but our treatment is more effective and more accurate. So by their body type. And of course, pulse diagnosis and blood pressure, this will give you a hint of the body type of the patient and what not to use and what should be used for the problem. Even they have the same name. Oh, doctor, I have been diagnosed with the skunk disease. Do you have something for it? Of course we do, but different people with different treatment combination. See, this skinny people, maybe a little too much fire, and chubby people, more damp, water retention, damp heat, and this muscular guys might have more stagnation, may even have low energy, and this one will have more damp heat, and the skinny one might have a little fire from anemia, and this normal one is fine, but the muscular ladies might have the same thing here. They have a lot of blockage and cholesterol. So different body type will have different combinations for them. So we'll be talking about that today. We will be talking about this on every seminar. It's very important. If the qi deficiency, we have to do something about the qi. In addition to the major combination for his major disease, we need something for the young, sometimes for the flame, to get a better result for the in deficiency, solid deficiency like protein or anemia or qi stagnation, not only deficient but stagnation and damp heat for the something. Blood stasis, this is mostly commonly, you will see this a lot in your daily practice, and especially in intrinsic. There's nothing related to that from others, the surroundings. We have to make the decision of what kind of a problem they have according to their body type. Then we make the treatment. Okay, the first one is a little bit serious. Pancreatitis can be the result of something. They have a lot of symptoms, such as sorry, I did it again. People might tell, oh, I'm throwing up, vomiting with the pain here. Looks like it's some kind of a gastritis, but and alcohol people will have definitely a fatty liver. And the pulse can show you the fatty liver clearly. And abscess will have fever and fast heartbeat, pseudocysts have a lot of short pulses. And this the necrosis, it's the dead blood, stagnation, something all in here will cause pain. So if you want to treat a guy with a pain here, or according to your own diagnosis, you have something here, okay? Then we do treatment differently according to the nature of his problem. Locked, stuck, gallstone, and this pancreas together, stuck in there. The pulse can be very clear. This is easy to find out. Mumps, but this is something different. Mumps is from virus, and this can be treated by Chinese medicine effectively. Interesting. Pancreas here. So all this in the middle, see? In the middle jaw of a human body. So the pulse should be in the left one. and of course, right one. Mostly it's on the left one. So left one is the middle part. It's the liver, gallbladder, pancreas, stomach, all together. Actually, sometimes we don't need to tell the difference between them. The treatment will be unique and not too difficult. Okay, pancreatitis. Common causes, there are several reasons for that problem. Divide the following: a gallstone pancreatitis, gallstone here, gallbladder here, and the pancreas hidden behind the stomach. So sometimes people tell you, oh, I have a pain here in the middle jaw, like this, the chest. I have a pain here. Maybe it's stomach, maybe it's not. Actually, frankly, the treatment is almost the same. And the gallbladder, gallbladder here on the left one, this is on the right one, and both together, we do our own judgment before we use the medicine. But most of the time, this pain should be here on the right side, and left side is mostly this. But actually, I don't really care where the pain is. I just simply use my combination, very effective. Today, I'm gonna introduce you my unique combination. You will see. So gallstone, blockage of a gallstone, especially microstone or sludge. The pulse is like this. Left one. I mentioned it many times. When you take the pulse, in the beginning, we do with the finger bed to feel the pulse, the jump, and the shape. But then again, we should do the pulse taking with the fingertip directly, vertically to the place. Then you might be able to find a little bing, a little bump under the left one. So then it's this, or maybe this. But anyway, we do the same thing. Okay. So where the common sludge, so that's the pulse is here. Very greasy. I always say greasy. Greasy means the shape is not so clear, not like a blood vessel should feel like, but it's kind of muddy. Yes, I thought of muddy. And if you push down with your fingertip, you will find a little things there. And that's this problem. So where the common bile duct meets the pancreatic ducts here. So they might have pain. You know, a lot of Mexican people have the problem with this. Maybe they eat too much spinach. Spinach is no good. And alcohol too. So first one is gallstone pancreatitis. First thing, Okay. The blockage causes pressure in the pancreatic duct here, and the pancreatic enzyme cannot drain properly into the duodenum. So the acid and alkaline juice cannot meet with each other to make the digestion of your greasy food. So it causes a lot of discomfort and bloating, a lot of discomfort, a lot of, hey, doctor, I have a lot of gas. Sometimes gas is air. Air is the lightest thing in your stomach, so it goes up. So make your stomach like a balloon. Someone tell them, hey, your body and your stomach is so bloated like a balloon. The pulse will be like this. The right hand side, 寸关尺. The pulse between 寸 and 关, like this, like a bump. Then you can tell maybe like this, hiatal hernia or something like that. We can use 半夏厚朴汤 to destroy that. But you must ask the patient to eat their food slowly and chew more times to avoid all this condition. But trypsin enzyme abnormally activated with the pancreas triggering self-digestion, causing the pain here. So we must do something about the gallbladder, the pulse on the left ones. And also, the left one, the liver area also makes the mood, the emotional area. So we should do the emotional, physical treatment for the physical condition and for the psychological condition at the same time. Sometimes we can do it together, but maybe not. At least you should advise your patient to eat slowly with a good mood. The next condition is this bioreflux, also directly damage pancreatic epithelium. This bioreflux can happen especially, I learned this when I was in Taiwan, this can happen specifically on young people, like around below teenage, like 10 years old, 12 years old, they have this bioreflux. I really don't know why. Their left one is something like this, or like this with inflammation. Left one, So in this case, they have a lot of a discomfort of the middle jaw. They have a problem. They always, their parents will definitely always bring them to the stomach doctor, gastrointestinal department of the hospital. After they check something, they take a lot of stomach medicine, but didn't help much because the problem is not in the stomachs, in the bile duct. So what I'm trying to tell you is, next time if the patient's major complaint is discomfort in the middle jaw, so bloated with a gas or something, no matter what, you should focus your pulse diagnosis on left one, where the bile duct meets the pancreas. Remember that,你中文我们说一下啊。胰腺炎主要是几大类，就是胆道疾病跟酒精。那当然喝酒就不用说了，过量的酒精就跟胆一定有关系，而且不但是酒精，而且是油腻的食物。因为油腻的食物必须要有胆汁才能消化，而胆道的疾病，胆囊的分泌这个胆汁是受到这个主嚼。你的嚼你的食物，你不嚼你的食物，它这个胆汁没有受到刺激，它就不会分泌出来。所以你的胃里面只有胃酸，胃酸不能分解油腻的东西，油腻的东西只有用碱性的胆汁才可以分泌。所以你这个时间久了，这个胆囊炎及胰脏炎就跟出来了。再加上吃油腻的东西，喝酒的时候当然要用下酒菜嘛，对不对？下酒菜总不会用青菜嘛，都是很油腻的，对不对？所以这个时候就会发作了。再加上喝闷酒，情绪不好心情郁闷，然后就开始有这种胆结石出来了，就堵塞了，然后导致胰管的压力升高，胰酶还有胆汁都不能排入十二指肠，所以变成你的自我消化，就胃酸就会过多，那你就会吃一些胃酸的药。其实这毛病是在胆，要从胆来治胆汁逆流，我就刚刚讲说，在台湾的经验就很多小朋友，我为什么会知道呢？因为我那时候发现在把脉的时候，小朋友有很多很多肝火，左关，我就奇怪了，为什么小孩会这样？肝炎吗？不可能，那小孩怎么会呢？有时候我忍不住会叫他们去做一些生化检查，验血、抽血验一下，结果验出来就是胆汁逆流，就胆红素等等的升高，就有这个胆汁逆流的现象。我也是从他们身上学来的，然后从那时候开始，从那开始怎么样呢？这个原则是这样治胃病要从肝胆下手。不能直接治胃I'm trying to tell them that if you're treating a problem, the major the complaint is the stomach discomfort. My stomach hurts and the reflux something. You should focus on the liver and gallbladder and also the pancreas. They are all one group of stuff.